Well, excellent. With that, we'll get started. Just some housekeeping rules. Well, first of all, thank you all, everyone, for joining Stavros's conversations with the candidates. We've got some folks attending on Zoom, watching the recording as well, maybe later on. So thank you all for coming, and a special thanks to Jake Oliveira Oliveira, I should say.
You got it right the second time. You corrected.
Yes, I'm sorry.
I've been called every name possible. It's funny, my colleagues that are Puerto Rican call me Oliveras, so I'm Puerto Rican. My colleagues that are Italian call me Oliveri, so I'm Italian then. So I can be whatever you want me to be.
You're a world traveler.
But I'm Portuguese. And that name is Portuguese.
Excellent. So thank you so much, Jake, for attending, and for everyone for helping me so much with organizing this event. Also, special thanks to our interpreters, Marcus and Taylor. Will be joining us, and we will be spotlighting them for your convenience. For in-person participants, we just ask you to wear a mask when you're not drinking coffee or eating. Please try to keep a 6-foot-ish distance from others and respect our workspaces, of course. Please note that your microphones should be muted upon entry. You should keep your microphones muted unless instructed otherwise. We will be using the live closed caption function on Zoom and ASL interpreter services. And as I said, those interpreters will be spotlighted. Time permitting, we will provide the opportunity for questions and comments at the end of the discussion. Please keep any communications during these conversations cordial and appropriate, of course. And given time limitations, we might not be able to cover everyone's questions or all the topics that were noted on the survey. So with that, I'll introduce myself. My name is Brianna Zimmerman. I am a white woman with a dark blue Rev Up shirt that says register, educate, vote, use your power. I have dark reddish hair now. I dye my hair all the time, so it changes, and I have glasses. I will be moderating today's conversation and also asking Jake Oliveira questions. So I am the systems change advocate here at Stavros. I work on our legislative priorities. And so that's me. Stavros Center for Independent Living works to empower people with disabilities and provide the necessary tools and services for people with disabilities to live independently. Since 1974, we've been actively advocating for the civil rights of people with disabilities, regionally, statewide, and nationally. By law, at least 51% of the staff and board of directors at Centers for Independent Living must be persons with disabilities. So we really know about the experience of living with a disability from firsthand personal experience. Please note that we are a nonpartisan organization that cannot endorse particular candidates. And then second, I would also like to thank Dignity Alliance Massachusetts, a grassroots advocacy coalition that formed during the onset of the pandemic in response to the high rates of death and infection in long-term care facilities. The Alliance is made up of nursing home resident advocates, disability rights organizations, legal service entities, mental health organizations, health policy experts, faith-based groups, and labor organizations. And it centers the voices of older adults and individuals with disabilities. All right, and so with that, thank you all for attending, and thanks to my supervisor, Nicole Rodriguez, for helping so much with this. Our CEO, Angelina Ramirez, for also helping to organize, Jason Montgomery, our Director of Development, and Iohann Rashi Vega. And he is handling all of the tech audio stuff, which, as you can see, is not an easy job. All right, and so with that, I will have Jake introduce himself.
Great. And well, first of all, thank you to Stavros for hosting this event and having a forum where we can actually speak on issues related to persons with disabilities. I think it's a very important topic that we really don't discuss much in debates. We talk about infrastructure, we talk about education, we talk about making sure that we fix our veteran services, but disability services, we've come a long way in the last 30 years here in Massachusetts. I have in my house district right now, the former Belchertown State School, and that's in it, that has had a storied history with the disability community. And we've been working to revitalize, but also to tell the history of places like the Belchertown State School. But my name is Jake Oliveira. I'm a state representative from Ludlow and represent 4 out of the 12 communities in this new state Senate district. My hometown of Ludlow, but most of Belchertown, part of the city of Chicopee, and the Indian Orchard section of Springfield. And my roots are very deep within the state Senate district. My family's been here for 4 generations. They moved from Portugal and Poland in the early 20th century to settle and work in the mills that dot our riverways here in Western Massachusetts. And it's been an honor and a privilege to actually be part of the revitalization of many of those mills and older projects such as the Ludlow Mills Complex in my hometown, where I've been able to secure millions of dollars for affordable housing, water and sewer issues. And so my priorities have been focused in on really growing Western Massachusetts economically, but investing in key areas like education and infrastructure. Prior to joining the House, I actually spent 16 years in local government, 4 as a rep town meeting member and 12 as a member of the Ludlow School Committee, where I actually served in 2016 as the president of the Massachusetts Association of School Committees, advocating on behalf of our public school districts here in Massachusetts. And at the same time, I worked for the state university system in my full-time job, doing government relations for our 9 state universities, your Westfields, Worcesters, Fitchburgs, my alma mater, Framingham State, Bridgewater, Salem, Mass Art, Mass Maritime, and MCLA. And then prior to that, I actually spent some time working in the legislature as a legislative aide to the now chairperson of the Senate Ways and Means Committee, which is the budget writing committee in the legislature, which is an important relationship to have as a new state senator. But when Eric Lesser decided to vacate the seat to run for lieutenant governor, the district lines changed a little bit. And so originally in the current state Senate district, there were 9 communities, including significant chunks of Springfield and in Chicopee. And through the redistricting process, the communities of South Hadley, Palmer, and Warren were added to the district, making it move from the first Hamden and Hampshire to the Hamden, Hampshire, and Worcester district. The town of Warren is actually Worcester County, so that makes it, but they relate much more to Western Massachusetts than they do to Worcester County. But I got into this race because I'm committed to making sure that we have a strong advocate on Beacon Hill, someone who's built those relationships so that we get our fair share of funding for things like our K through 12 system. You know, I fought very hard to pass the Student Opportunity Act, which is going to be pumping in millions of dollars into school districts that were neglected for far too long, places like Springfield and in Chicopee, but also areas like Holyoke, and then making sure that we invest in other areas of education. You know, Springfield is the first school system in Massachusetts to do full day, all day preschool for universally. And I hope to, utilize some of those dollars that are coming into the federal government to help other school districts to provide that universal preschool education to every child in every school district here in Massachusetts. As a House member on education, we voted to make school lunch universal and free to every student in Massachusetts, regardless of your zip code, which is an important achievement that we fought very long and very hard to get. I'm proud to say that we voted to put that in the FY23 budget, and that's a reality. But we also need to invest in the other end of the education spectrum. Having worked for our public higher education system for a long time, I know that 2/3 of graduates of our high schools here in Massachusetts go on to one of our 29 public colleges and universities. universities. And I'm not just talking a 4-year education. I'm talking to Springfield Technical Community College, people that are going into the trades like plumbing and electricians. And Massachusetts ranks right now 48th in the country in funding towards our public higher education system, meaning that we have some of the highest costs out of any segment in the country right now. So making sure that we reinvest in that public higher education system is good for our economy, particularly here in Western Massachusetts when so many jobs are tied to the higher education sector. At the same time, we have a historic opportunity to invest in our infrastructure. And I'm not just talking about our roads and bridges, which are very important, are ranked 48th in the nation, but to invest in things like West East Rail and make that a reality. I was proud to be part of the small group of Western Mass legislators that crafted legislation in partnership with our congressional delegation, Congressman Neal, Congressman McGovern, to make sure that we make West East Rail a reality. And I fought very hard to include Palmer as a stop, not just Springfield, but Palmer, because you tie it to the economy of that end of the state and make sure that it's a reality. But also investing in our hidden infrastructure. Ratepayers are on the hook, particularly for things like water and sewer, that we're set to see double-digit increases over the next couple of decades because the federal government and the state government has not invested a single dollar since the 1970s. We have an opportunity right now with the Inflation Reduction Act that was passed by the Congress and the federal infrastructure bill to actually broaden that definition of infrastructure. And it's up to state legislators in the states right now to reinvest in those programs. And that will be a priority of mine as your next state senator. But other areas that are very important to me reflect the committees that I serve on in the House. I have the privilege, and this is important for the conversation that I hope to have, I have the privilege of sitting on the Children, Families, and Persons with Disabilities Committee, which oversees disability services here in the Commonwealth, and I've heard so many bills that impact so many people. But another very important committee is the Consumer Protection and Professional Licensure Committee that I sit on, where I was proud to vote in favor of something that's really now near and dear to my heart when I learn from the advocates. So right now, people that are suffering from a disability that rely on a wheelchair or a scooter right now, those are very expensive pieces of equipment. The average cost for a wheelchair or a scooter for a new one is anywhere from $1,500 to all the way to $32,000 right now. And when those basically life-saving accessible needs for these individuals, when they break down, there are very few lemon laws on the books here in Massachusetts to provide an actual replacement or a timeline of how they're being replaced. I heard from people that rely on wheelchairs and scooters that when their mode of transportation breaks down, that they have to wait sometimes not days, but weeks or even months from the manufacturer to hear when those parts or that life-saving scooter or wheelchair will be available for them. There's also a very short window right now on the time in which you can actually, get a full refund. So the legislation that I'm happy to co-sponsor and work on and hopefully push over the finish line next session provides up to 2 years warranty on it, just like we do with our lemon laws for your vehicles here in Massachusetts. It makes sure that if your wheelchair or scooter breaks down, that there's a timeline for actually finding out when you get one, and that you get a replacement within at least 4 days from it being under the weather, because this is not something that you can't go without. You can't get to school, you can't get to work, you can't do your groceries. It's so important right now, and I'm proud to be co-sponsoring and helping to shepherd that bill through the legislature, through the Consumer Protection Committee. I have probably gone on way too long and need to go on to questions right now.
Couple. So we're
Right.
ahead of the game.
So I'll turn it back over to you just to have more of a conversation. Happy to entertain any questions that might come from the Zoom platform as well.
Excellent. It looks like we've got an interpreter switch, maybe. All right. So thank you, Jake, for introducing yourself and describing so much of what you have already done as a representative. Of course, we're all thrilled to hear about the wheelchair repair bill. That's something that we at Stavros have worked really hard on. So my first question is that most Massachusetts residents know someone who has needed either long-term care services or other types of disability services due to issues related to aging or disabilities, or experienced it themselves. Has anyone close to you needed nursing home care, congregate living arrangements, home and community-based services like PCAs or personal care assistants, or other disability services, such as the services that we provide here at Stavros? What implications for public policy and regulatory enforcement do you draw from that experience?
I don't think that there's a family that exists right now that hasn't experienced someone who's either living in a congregate care facility or someone who's relied on a little extra help, particularly as we have an aging population here in Western Massachusetts. I have a 97-year-old grandmother that lives right next door to me in Ludlow on East Street, who is still living out on her own, but requires a lot of help. And that form of help has been family support right now, but we're just on the cusp of possibly having someone come on in, whether that's, short term to do some of the basic, necessities, whether it's bathing, nail clipping, food preparation, those types of things. But the person that I really, relate back to is actually my grandmother's sister, who passed away about 15 years ago now, who suffered from very bad Alzheimer's, who actually my grandmother as a, 78-year-old, almost 80-year-old was taking care of full time, and just got to be a point where she couldn't take care of her anymore, and we had to look for other options. And she became to a point where she was so debilitated from that awful disease that she actually had to go into a place of full-time care. She was at Providence Behavioral Health Hospital before it closed, where she stayed there for a while, and she suffered from it. She was a very scared individual. She was someone that didn't have, a lot of the functions that you would think. She scratched a nurse and had to have a guard outside of her room. And the fear that she felt as an individual being put in that situation was something that was such a strain on our family. But also it showed and highlighted the need to actually have facilities that can help out with people that are suffering from some sort of debilitating illness. One thing that I've looked at here in Western Massachusetts, and this informs my public policy standpoint, is that when Providence Hospital closed, there isn't a single youth adolescent mental health bed left in Western Massachusetts right now. And part of the bill, the mental health bill that we passed this summer, directs DPH to ensure that there is equity, regional equity with mental health beds in our area. My sister just finished working at Noble Hospital in Westfield, and they would have children in the pods there for beyond 30 days. That's unconscionable to me, that you have a child sitting in basically a cell room in an emergency room. We need to build more facilities and have more beds access, not just for adolescents, which is we're in dire need, but throughout the spectrum of care for mental health. Looking at our senior living facilities, I have in my district in Belchertown, Christopher Heights, which is a wonderful model because it blends in some private pay, but also with some state pay. So no senior is actually, left out in the cold on there if they can't pay for it. And we're seeing more and more of right now is the inability for people to pay out of pocket. It is very expensive for this type of care. It's very expensive to have 24-hour care right now. And that's why it's so important that Massachusetts, we as a Commonwealth, have the support systems for families, especially as people are living longer and longer, that we have the supports on there for families to actually go in and house their loved ones in a safe, respected environment. And that goes for the disability community as well, making sure that those services are provided for them. And that's why as a legislature, we can't, cut our way out of it. We need to expand services because families are going to be relying on it more and more. They don't have the money in the pocket to do it. And when those private savings are depleted, it's incumbent on us as a society to take care of those that have needs.
Absolutely. Well, thank you for sharing that personal story and also how that connects to your thoughts on public policy. So you mentioned nursing homes, and that is one of the issues that Dignity Alliance Massachusetts and the advocates here at Stavros are sort of working on. we see a huge issue with people lacking affordable housing. There's a huge affordable housing crisis across the state, and even more so for people with disabilities who need accessible housing and accommodations. And so people with disabilities are actually more than twice as likely to experience homelessness than non-disabled people. The Architectural Access Bill, an act relative to expanding the availability of adaptable housing for consumers with disabilities, mobility impairments, and seniors, that's the long name, would make it so that the Mass Architectural Access Board would actually have authority over buildings that were built before 1991. Right now, the Mass Architectural Access Board, MAAB, does not have that authority. So they would, under this bill, have authority over housing or buildings that were built before 1991. And it would also require employee-only areas and workplaces to be made accessible. So that bill has not passed yet. And so if another bill like this or this bill was going to come up in the legislature, would you consider supporting this bill, or more broadly, what is your plan to increase the number of affordable and accessible housing units in Massachusetts?
Thank you for that question. Housing is becoming a bigger and bigger issue, even in Western Massachusetts, where we tend to have much more affordable housing than the eastern part of the state. I always use the example here in the city of Springfield. In order for a family to afford the average rent rate right now, they need to earn 130% above the median family income of the city of Springfield right now. We are lacking in affordable housing stock, and that's where I think some of my legislative work has already kicked in. I was able to secure about $2 million for affordable housing in the Ludlow Mills complex, which is going to be over 55 mixed-use housing that will include some market rate, but also affordable housing to keep rates down for folks that are struggling with it. We have mills and buildings that dot our riverways here in Western Massachusetts, and with support from the state and from the federal government to invest in affordable housing, the bones of these buildings are really strong. And making sure that they're adaptable for 21st century use and accessible use. We're celebrating, 32 years since the signing of the American Disabilities Act right now. A lot of these buildings aren't compliant. And so having the state help communities and help developers actually make these facilities accessible is so essential to providing that access to housing, but it goes beyond that. And I'm glad you mentioned that bill that was pending that did not pass this legislative session. There are 7,000 bills that are filed each session. I have to read into it a little bit more before I can make a decision, but my goal is to make sure that we build more housing to solve our affordability crisis here in Western Massachusetts and the homelessness crisis that's impacting us right now. I actually met with developers that are in the tiny home industry. And so Massachusetts is actually, we have some of the strictest laws on buildings and codes, and California is actually leading the way with tiny homes that could be seen as a model to help with our affordability crisis for housing right now. And so the tiny homes really doesn't fit in Mass General laws. So we're actually working with Housing Committee Chair Jim Marciero from Westford on a bill that will actually authorize greater access to these tiny homes, because they would be a perfect example of how we can help in an affordable way solve this housing crisis, because they are small in nature. It requires less cleaning. It requires less space to actually for them to be built on. And it's good for multi-generational families as well. We're seeing people living longer and longer. Having access to a tiny home that could be placed on a property or in a different location could help to solve this housing crisis that's impacting us right now, but also eliminating some of those barriers that exist to building new housing and making sure that we do it in an environmentally friendly way and make sure that we're still preserving open space. That's why these models such as Mills complexes right now are so important. I also have the old Belchertown State School in my district right now, and there's a plan to build mixed-use housing in an area that preserves a lot of the land, but also provides affordable housing for the communities and making sure that it's accessible. I was knocking on doors in Granby just about a month ago, and I ran into a woman who is in her early 60s. Her son, who is, I believe, has Down syndrome and a few other disabilities right now, is getting older, and it's getting harder and harder for her to take care of her son. She actually is looking at a program in New Hampshire right now where it's actually a tiny home model with a farming community to actually allow the residents to actually work the land. It's also a model that's been followed in Wisconsin. It's in New Hampshire right now, but we don't have anything like that here in Massachusetts. So expanding the diversity of our programs for families like that who are struggling, just to make sure that they're providing the care to their children that are suffering from disabilities, it's important that that's part of the framework as we look to expand those affordable housing opportunities.
Excellent. Thank you for sharing all of that. And yes, please let us know if you need more information on the architectural access bill. Be happy to provide that information for you. My next question centers around transportation. I hear a lot here that housing and transport. Oh, it looks like we have an interpreter switch. It looks like we're all set. Okay, so yes, so we hear a lot here that transportation and housing are two huge issues that are really lacking, especially for people with disabilities. Many people with disabilities and senior citizens rely on regional transportation to get to work, school, medical appointments, and just to socialize and be active members of our communities. But regional transportation is currently pretty underfunded. We increased the funding a little bit this year, but we still want more. Therefore, we can't always meet community needs with regional transportation. Many regions cannot afford late night or weekend services, and that issue is really compounded for paratransit riders. The RTA advancement bill would increase transportation access by ensuring adequate funding for RTAs, dedicating 50% of Lyft and Uber's fees to funding RTAs, adding 2 seats for frequent riders to the RTA Council, support electrification of RTA buses, and stop basing RTA performance on profitability, which really deepens inequalities. Thank you. We wanted to thank you for supporting increases to the RTA budget. I know that I'd seen that you had supported that. Do you have other plans for increasing regional transportation access in your district, particularly for people with disabilities?
Absolutely. I'm proud to be a member of the Regional Transportation Caucus in the legislature, which is actually led by Natalie Blay, who's taken a leadership role out here from Sunderland in Western Massachusetts, as well as Representative Peak, who's from Provincetown. And we have a patchwork of regional transit authorities here in Massachusetts, whether that's the PVTA, which we all know very well here in the Pioneer Valley, or the Worcester Regional Transit Authority, and some of the smaller transit authorities that are regional in nature. You know, I was very disappointed in the Baker administration for consistently underfunding our regional transportation systems, and it was incumbent upon the legislature each year to put back the money into those programs. And that caucus has really highlighted the attention of a lot of the regional transportation authorities that we have in Massachusetts right now. When I look at PVTA here in Western Massachusetts, I actually worked with them to change some bus routes in Belchertown to better access the courthouse that's there right now. And sometimes it just takes a phone call. Pick up the phone, call your legislator if your route isn't serving the needs of your community, but making sure that they have reliable funding in order to actually access areas, particularly the rural areas right now, which concerns me. You know, we have a fairly reliable system within the city of Springfield, city of Chicopee, but as you get less dense of a population, it tends to be a little bit harder to access these regional transit authorities. I look at Granby in my district. I look at, you know, Warren. I look at Hamden. There are needs that are there right now, and without having reliable bus service and the funding that goes along with it, you're going to continue to underserve these areas. But transportation for the disability community is essential as well. You know, we mentioned wheelchair and scooter access before. I mean, if you don't have an accessible vehicle or an accessible bus or an accessible van in order to access this, you're put farther and farther behind. I was proud to secure $50,000 for the Ludlow Senior Center, which operates a bus within our community to transport seniors to, you know, the grocery store, to doctor's appointments, to the senior center itself. And we're actually going to be having an announcement, I believe, next week for the funding for that type of project. You know, it's a one-off that's on there, but these transportation vans and buses are so important to local communities, and particularly seniors and those suffering from disabilities, to have access to all the needs that you have to live. But looking kind of longer term at our transportation issues, it's also about tying us as well with our rail systems. You know, we're at a crossroads here in Western Massachusetts where, you know, you have the 91 corridor or the Connecticut River Valley, and you have kind of the Mass Pike. I can tell you right now, I travel the Mass Pike many times a week. And if I leave from Ludlow, which it should be an hour and 10 minutes, an hour and 20 minutes to the State House, it will take me 2.5 to 3 hours to get into the city just one way because of the congestion and the lack of supports that we've had for a much more regional transit approach. I'm proud to say that in the budget, the transportation bond bill we passed this summer was the authorizing language for West East Rail. And it creates a commission that will guide the work, that will take in the billions of dollars from the federal government and guide it to make sure that we repair the tracks, repair the stations, making sure that they're accessible so that people can access our state capital. I think it's a shame that I can get to 3 other state capitals in less amount of time than my own state capital in Massachusetts because of traffic. And so that is something that we are committed in the Western Mass delegation is speaking on as one voice right now. We got Governor Baker on board. We have Congressman Neal, Congressman McGovern working the federal angle, and we're right at the cusp of actually getting it done. And so I'm laser focused on making sure that as of January, when I take this state Senate seat, that we focus in to make sure that we follow through on making sure that West East Rail becomes a reality, but also making sure that the North-South link is expanded and maintained. There are a lot of people in our region that work in Connecticut or even New York at this point. And so we have the ability to not just do West-East, but also North-South as well to connect us all as a region. So I think all of those things are not only good for the economy, because those are good jobs. Those are trades jobs, construction jobs, building the lines, building the tracks on there, but also as part of the framework to access a lot of the regional transportation authorities when people are moving around in here. And that's what we need to expand.
Excellent. Well, we're excited to hear about East-West Rail and the expansion of RTAs. I know that we're running out of time here, unfortunately, but I think we have time for maybe one more question. And so I will jump to discussing nursing homes and your opinions on quality of care and oversight of nursing homes. So as we saw in the case of the Holyoke Soldiers Home, negligence in maintaining public health and safety can result in serious illness and death, particular for senior citizens and people with disabilities. Right now, so there's over 80 residents of the Holyoke Soldiers Home that died from COVID-19, as I'm sure you know, and many more residents and staff became seriously ill with the virus. Advocates have been pushing for a change to long-term care away from large facilities where many residents face neglect, abuse, and indignity. During the 21 to 22 legislative session, the legislature actually authorized the issuance of a bond in the amount of $200 million to undertake small house homes for veterans and local communities throughout the Commonwealth. Would you encourage the implementation of this project in your work as a senator? And also, what else would you do to protect people in long-term care facilities, protect their rights, and also protect them from neglect death, abuse in nursing homes?
Thank you. Thank you for that question. And having met with many of the families who lost loved ones at the Holyoke Soldiers Home, over 80 of our veterans, people who served this nation and served it decorated from World War II on in many of our wars, what happened to them was preventable. And we've seen that the courts have seen that, the attorney generals, and as the legislature has provided the oversight over that. That really goes to show you need to have qualified people that are managing these facilities, not people that are politically connected. And so part of what we did to make sure that what happened there never happened again wasn't just, changing the structure of it to make sure that you elevate certain positions so there's a direct line to the governor's office instead of many layers through Health and Human Services in order to get to decision makers, but also making sure that people that are leading these facilities are experts and are trained and are qualified to actually be administering these facilities right now. That was all part of the authorizing legislation that I was proud to vote for, proud to work with partners like Senator John Violas and other folks here in the Western Mass delegation, Leader Wagner, who were instrumental in making sure that that bill got passed, but also making sure that the facilities themselves meet 21st century needs. Talking to my colleague, Representative Pat Duffy, who represents Holyoke, looking at that facility right now, what went on there, they were shuffling people inside. If you read the Boston Globe story, it would show the shuffles and the outbreaks that were there because people were on top of each other. They were in rooms like this with beds right next to each other, which wasn't conducive to actually preventing the spread of this virus. And so what we did in the legislature, aside from the $200 million authorized in the bond bill for greater access and more, 21st century looking for housing, is $400 million to build a new Holyoke Soldiers Home that will not only serve veterans themselves, but also veterans' families in suite style areas. So if there is another pandemic or the expansion of something, you can actually separate people out so the virus doesn't spread. Those types of changes to the architecture of congregate care facilities, whether it's soldiers' homes, nursing homes, other facilities that house folks on there, they need to meet that. And so helping these facilities refurbish themselves to meet those needs and prevent the spread of virus is incumbent on us as policymakers, but also as us to have the proper oversight to ensure that these facilities are caring for people in the proper manner. And that's all part of legislation that we're looking at longer term, but looking at our aging community. The baby boomers are aging right now. They're starting to enter a lot of these facilities at higher numbers, and there's a larger percentage of them right now. We need to make sure that we meet that demand, and we need to make sure that we hold accountable and ensure that people that are qualified are the administrators of these facilities, because without that, we could have another situation like what happened at the Soldiers Home in the spring of 2020. So it is preventable, but it's a combination of state oversight, it's a combination of regulations, but also the architecture of a lot of these facilities right now to meet those needs.
Yeah, excellent. And so that will be our last question. I do want to underline the fact that Dignity Alliance Massachusetts has been advocating for a variety of bills on nursing home reform. Right now, it's just really difficult to pin down who should be held accountable in nursing home management and ownership. And we just really want to underline the fact that people in nursing homes and long-term care facilities need more rights. And typically people do prefer to age in their home when they do need to go to a nursing home or long-term care facility. We want to make sure that there's accountability structures in place. We want to make sure that people know their rights, that people are protected, and that they're living in an environment that's best for them.
So add on that point that, it's also training for the employees themselves as well. I've partnered with SEIU 1199 and getting a training fund for them. So they have the tools to actually update and train their employees so they have the tools for themselves in order to operate in this new environment. And that's important to say. There are many well-intentioned people that are working within our in the healthcare system and working with individuals. They need the supports.
Yeah, absolutely. And you know, staff need more supports. They need more, they want more education and training and more pay. And so and they want more protections from things like COVID-19. So very important points there. With that, we are running over time.
So sorry.
No, that's okay. And so now I guess I can open it up for a minute or two to see if anyone has any questions or comments while we have our interpreters for the next 10 minutes or so.
Are there any questions on the chat that we don't see?
Let's see.
To be under more.
Right now, we're just checking the chat for questions. No questions right now.
Yeah, I have some questions.
Oh,
Yes, absolutely.
I'm sorry my back was to you over here for
Okay.
most of it. Hopefully you can hear me all right.
Oh,
Can we just change the interpreter pin?
would you be?
Go over there.
Oh, okay.
Yeah. Sorry about
Excuse
that.
Okay, okay. Hi, everyone. My name is Ruth. And I was listening to you and very, very interesting things that you're doing, all of them very important. But personally, I have some experiences. I'm one of those baby boomers.
So is my mom right over there as well.
Really?
Yeah, that's my mom in the back. Yeah.
So, and I moved from Maryland to the state of Massachusetts because all my family is here. And I have been experiencing a lot of doctors finding a doctor-ish, you know. Here in Western Massachusetts, we don't have a specialist. I mean, it took me 6 months to get a glaucoma doctor, a specialist in glaucoma. Another 6 months to get a periodontist. And you're not going to believe, 1 year waiting for a pulmonologist. And they called me last week to reschedule for November. So is there anything in the system? I mean, I'm paying Part B, and I have through my employer my own insurance, which is a PPO. I tried to get a PPO, and they need a referral from the primary, which is not a real doctor. Well, it is a nurse practitioner, not to underestimate them, but you know, but you know, and sometimes I say because Bay State doesn't have it, you have to go through. I mean, it's a nightmare. So, are you doing anything or someone in the system to attract more specialized doctors here? Because I believe in prevention medicine, you know, and in here, all the benefits and all the services. You have to spend a lot of money for a lot of services because it could be prevented before you spend a lot of money in other issues, you know, after.
Oh, I know
You know
these
what I'm saying?
issues firsthand.
Frustrated. You can tell that I'm frustrated.
I share your frustration. You know, we've experienced this in my family firsthand. Try getting to see a dermatologist. You have a better chance of getting an audience with the Pope than you are to get an appointment with a dermatologist sometimes. I mean, we had to, so I suffered from debilitating eczema for years during my life. And it got to be a point last summer where I just couldn't stand it anymore. And, you know, waiting 6 months to get an appointment for a dermatologist in order to see you doesn't help you when you can't sleep at night. It doesn't help you when you're experiencing other issues from it. And, you know, luckily, you know, between my mom and myself, you know, basically staging a sit-in in the dermatologist's office, we got an appointment and I got the help that I needed on a new medication on there. But it took, I mean, imagine if we, you know, we're fairly well-educated people who have the time to actually stage that. So if you're facing language barriers, if you're facing issues of, you know, the ability to advocate for yourself and you're just told no a lot of times, then you're going to be waiting, you know, those months that are on there in order to see a specialist. So what we've tried to do in Massachusetts is focus in on that preventative care. And so building the pipeline of specialists to actually, you know, don't go out to the Boston area. Stay here in Western Massachusetts so we can do things, but also encouraging people to go in those fields. There are a lot of fields right now, especially with geriatric care, that's becoming greater and greater need right now, encouraging people, whether that's through loan forgiveness or the ability, because here in Massachusetts, we don't subsidize graduate education. So there isn't a scholarship program to go get your master's or your doctorate or anything else, but we can do things on the loan forgiveness side, hopefully, in order to encourage people to go in those professions to meet those needs.
That's another thing. I
Yeah.
was talking to my doctor about that because she said there's no people studying this because they're not going to get paid as
Yeah.
they wanted to, because they're waiting
Mhm.
also for Medicaid, because it's a billing problem in Medicaid
Yeah.
system.
And we're actually working on that billing problem right
Yeah.
now to make sure that they're fixing that, because I've heard from doctors and the
Doctor
fights with
doesn't want to-
insurance companies right now of them gouging them on a lot of different things and not being able to actually get the reimbursement rate. We've been
Exactly.
working with Congressman Neal's office as well on
Exactly,
that.
because they wait for 3 months to get the reimbursement,
Mhm.
and they don't want to
They don't
go
wanna
into the
take that.
into
They
the
don't wanna take
medical
it.
system
Yeah.
anymore. And also,
Mhm.
if they are, they
Mhm.
stay where they can, have the accelerated process, like in the big cities, Boston, Baltimore,
Yeah.
the big cities. But here in Western Massachusetts, we need that.
Yeah.
And then she was saying about the nursing homes, because if there are no specialized people that, geriatric
Mhm.
people that work with those people, I
Mhm.
mean, with those elderly.
Yeah.
So.
And that's why.
We're never gonna get the
Yep.
nursing home that they
Yeah,
need.
and that's why this West-East Rail is so essential, because it better access us to back and forth between the Boston area, so that our specialists could, wanted to, come out here or do things, you can better able to actually connect. Sorry. Sorry. Thank you for, no, thank you for that question. I talked too much earlier too.
Thank you so much.
It does look like there's an interpreter switch, but at the same time, I think we're basically out of time at this point.
Thank you for the question. Thank you.
So I'm sorry to cut everyone a little bit
We can-
short. Thank you. A special thanks to our interpreters, Taylor and Marcus. We really appreciate your work. Thank you so much for being here, and thank you all, everyone, for being here.
Thank you.
And
Thank you.
I
Thanks,
guess with
everybody.
that, we are done. If you have any questions about legislation or about voting, please reach out to Stavros. My email address is bzimmerman@stavros.org. And that's BZIMMERMAN@stavros.org. You can also call our main phone number, and my extension is 121. So with that, I will end our conversation with Jake Oliveira. Thank you so much,
Thank
Jake. for
you.
being
Thank
here.
you.
Thank you all for coming.